National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, my name's Dr. Jonathan Beatty. I'm a naturopathic doctor and a health expert here at Nationalnutrition.ca. Today I want to talk about a symptom I see in my office all the time, and that is depression. Now, most people are going to catch the fact that I just said a symptom called depression, and that's what it is. Depression is actually a symptom of a variety of different types of diseases. So I always recommend that if you do suffer from depression, you will want to speak with your healthcare provider about some of the possible causes behind it. So depression is characterized not necessarily by sadness, but actually by a lack of motivation. Sadness is an emotional feeling, whereas lack of motivation, that lack of self-care, that inability to have get up and go, excessive fatigue, those can all be manifestations of depression or a depressed state. It's a little bit different from just sadness. Sadness can be triggered by a variety of stressors in your life, and they don't always mean that you're depressed. You're only depressed when you have that lack of self-care, that lack of motivation, and that excessive fatigue. And so that's what truly characterizes depression. Now, depression can be caused, as I said, by a number of conditions. It's actually a symptom of an underactive thyroid gland. It can be a symptom of an imbalance in hormones. It can actually be a symptom of cancer. So looking at depression, you have to understand that it's a symptom oftentimes of another disease. And in some cases, it can actually be a symptom of a nutrient deficiency. So depression is associated with deficiencies of essential fatty acids, and it can be related to deficiencies in certain B vitamins as well. So how I treat depression in my practice often relates to why somebody has depression in the first place. And for me, it's all about diagnosis. Get at the underlying cause of the symptom, and that's going to get you the most effective treatment plan. And the trouble with that is, of course, while you're trying to figure out what the diagnosis is, it can be very difficult sometimes to manage with depression. So there are some things we can do while searching for a diagnosis to try and alleviate that depression. And the reason most people suffer from depression is actually related to an inflammatory condition in the brain. So I'm a follower of the inflammatory model of depression, and the reason behind that is when you look at groups of people who suffer with depression versus groups of people who don't have depression, you don't really find any significant change in their neurotransmitters. And that's often been stated as the cause behind depression is, oh, it's an imbalance in serotonin, oh, it's an imbalance in norepinephrine. When in actuality, we don't see these imbalances in depressed populations, or at least no difference in imbalance in a depressed population versus a normal population. And so for this reason, I follow the inflammatory model of depression. And the reason behind that is what we do see different between a depressed population and a non-depressed population is in a level of inflammation in the brain. So a lot of the recommendations I'm going to make today to help manage the symptoms of depression are based around managing that inflammatory process in the brain. One of my favorite anti-inflammatories is a herb called St. John's wort. It's known as Hypericum perfoliatum, and it is actually one of the #1 prescribed antidepressants in Germany and in a variety of European countries. And it's a herb that manages nerve inflammation, and this is why I like it. Traditionally, it's been used for neuralgia or nerve pain. So anytime that nerve is inflamed, it can create pain along the nerve. And that's why we originally started using St. John's wort. And one of the cool effects of it, of course, because it's a nerve anti-inflammatory, it's very effective and very, very well studied as an antidepressant. The only thing is if you're on medications for depression, you do have to be careful with St. John's wort because it can change the way your body metabolizes any medications you're on because of how it manipulates a certain detoxification enzyme in the body. So anything you've got to be worried about grapefruit juice with, you will have to be worried about the same things if you take St. John's wort, because both of those do manipulate the same enzyme pathway in the body and can change the way in which your body uses certain drugs. Specifically for women using the oral birth control pill, St. John's wort can change the metabolism and may make it a little bit less effective. So just be aware of that impact of St. John's wort. That being said, it's a very, very effective antidepressant, and I do find it very effective with my patients. Additionally, what I'll do is supplement somebody with fish oil, specifically one that's high in EPA and DHA. So these are the key component fatty acids found in fish oil. And what they are is they're very anti-inflammatory fats. And typically, again, these are fats found in the brain, and they can actually modulate and reduce inflammatory pathways in the brain, thus getting rid of the actual cause behind the depressive state. Additionally, I'll also supplement people with B vitamins. B vitamins are very important in the management of depression. B12 deficiencies, B6 deficiencies, folic acid deficiencies, they can all be related to depression. And in fact, antidepressant medications have been shown to be more effective when combined with a B vitamin. So it is something I will recommend to all of my depressed patients. So get at the key cause behind your depression. Try and understand, what's creating the depressive state in your system. Is it thyroid related? Is it some sort of other inflammatory condition? Get a diagnosis as to what's creating your depression, and that way you'll have a better long-term plan to treat it. So I hope this video has helped you with your concerns. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.